So let's go to Norman Swan now. Norm, g'day. So, yeah, how is Australia doing so far in terms of trying to suppress the number of cases?
Oh, you can see, well, nobody can see your computer, but when you look at your computer, we are in the middle of the pack, but it doesn't take much. And if you look at WHO reporting data and look back at where Italy was when they had 400 or 500 cases, we are between 12 and 20 days behind Italy. That's what we are. Victoria is probably 4 or 5 days behind New South Wales, and the line's going straight up.
Right. But when you look at what's happened in places like Japan and Singapore...
So Singapore is starting to kick up as well, so they haven't shut schools. Right. They've been light touch, they're doing a lot of public information, but the numbers in Singapore over the last few days, they're starting to go, like New South Wales particularly, going straight up.
Yeah. OK, also in the UK, the government before now had this approach of herd immunity, or some people have described it as herd immunity. Explain for us what that is, and does it appear to be the case that they've abandoned that policy?
Well, they say they've abandoned that plan, but it may be too late. So the idea was that you couldn't actually control the virus completely, and that you would allow a significant percentage of the population, maybe 60%, to get the virus, and therefore that would slow the virus down. The trade-off for that would be maybe between 250,000 and 500,000 deaths in the UK, between 1.1 and 2.2 in the United States. So the strategy, and it's not all or nothing, I spoke about this to you yesterday, so it's a graded response. You add on one or other. Dan Andrews was talking about that, where you expect an effect of that. And the more measures you add on, including schools and universities, the more effect that you get in terms of controlling it. And the main game here is, in fact, to deload our hospitals so that people who need treated get treated, and we don't get unnecessary deaths because people are left at home to die.
And I understand you've been in touch with one doctor in the UK.
Yeah, I've got a text from a doctor in the UK which describes why in the UK they've announced that they're going to close schools because of what's going on in hospitals. So I can't identify this doctor because it's cause for instant dismissal. So it goes. Australia is probably going to get through this a lot better than the UK in terms of flattening the curve. We're totally effed over here, running out of PPE at light speed, and healthcare workers are dropping like flies. There are 2 of our consultants, in other words, 2 of their specialists on ECMO, that's heart-lung bypass. So in their hospital, 2 senior doctors on ECMO.
Because they've contracted...
Because they've contracted coronavirus. Current guidance from Public Health England is that all we need to wear for a suspected case is a non-fitted surgical face mask and a sleeveless plastic apron. Even if we're aerosolizing, they don't recommend a long-sleeved gown, and my bosses are just following this blindly like idiots, and partially because we'll completely run out of this stuff in a matter of weeks. So everyone is getting sick, and the first wave of public illness is only just beginning. There are some dark days ahead.
Geez, and that comes after we heard that comment kind of from an Italian doctor, I think it was, saying it was on Skype from the area affected there in northern Italy, saying this is a war zone. So we're being warned over and over by...
and I can guarantee that those 2 specialist consultants are not 70-year-olds from 80-year-olds from aged care homes. Those are young men and women, relatively young men and women. And so when you've got a large number of people coming through, the average age of people in intensive care on ventilation in Italy is coming down, because the more people who get infected, even though it's rarer to get seriously ill when you're in your 30s and 40s, you start to see more of those people just because of the pressure of numbers. And they get the intensive care, not older people. Very difficult decisions being made. That's what we're trying to prevent here. So we've lightly tapped the pedal. I think the community is responding more than the government's advice, staying home and so on. But I'm still hearing of weddings happening, people going out to crowded restaurants, not changing our behaviour. That is not going to cut it, probably, in terms of bending the curve. And this is a day-by-day thing. So fine, they put out the announcement yesterday, but if the curve is not changing in Australia, they need to do something drastic so it curves off, rather than waiting 12 days to 3 weeks to see that we're at just the same place as Italy.
And so Australia has not decided to shut the schools. The schools are going to continue for the moment. The UK was another place where that was happening, but overnight the UK has decided to shut their schools. What has tipped the scales for Boris Johnson over there in terms of changing the approach?
Well, they've not made a dent in the epidemic with their standard measures. Their hospitals are getting overwhelmed, and their own mathematical modelers, which we spoke about on the show yesterday, say that one of the significant things that you have to do if you really want to control this is close schools and universities, because in some countries, 30% of the spread of the infection comes from young people. They get it, they're not that ill, they don't know they've got it. I'm not saying they're deliberately doing that, but they're out spreading it. They're less infectious, by the way, because they're more mildly ill, but there's more of them, and 30% of infections come from them.
Yeah, I don't think we can bring up this graph that I was referring to before on my computer, but the UK is about, looks like the UK is about a week ahead of Australia in terms of days since their 100th case.
Yep.
And their cases are now up around 3,000, I think it is. Is Australia headed for that similar scenario or not?
Well, proportionately speaking, given we've got a smaller population, but proportionally speaking, if we don't change the curve, we are.
Yeah.
We've done well with border controls. We're doing as well as we can. We're not testing enough, but we don't have the resources to test more. So I understand that. But we don't know how much COVID-19 there is in the community. And New South Wales is the one that officials are really worrying about, but Victoria is not far behind.
Yeah. And so are you firmly more firmly of the belief now that schools will have to close, considering what's happened in the last 24 hours or so?
Well, I'm in the fortunate position of carping from the side, and I don't have to make that decision. But I think that if we haven't seen changes in the curve in Australia by this weekend, they're going to have to really say to people what Justin Trudeau has just said: stay at home, don't visit your neighbours, don't go out very much at all, only go out for your shopping, just really be careful.
Yeah. Okay, Norman Swan, thanks for coming in and having a chat.
You're welcome.